Hi everyone, it's Lisa again. I'm doing my video blog number 5 about my upper jaw surgery. That is in 3 days. On my last video, I talked about doing the massage therapy sessions and having a really good team for jaw surgery. And I said I was going to talk to you guys about the last the appointment that I was going to have the last time you see your oral surgeon before your surgery, your jaw surgery. That was that was Wednesday. So basically, you have to go to the hospital and pre-register, where they do an EKG and they give you all of the instructions on what to do before your surgery. And it takes a long time. Then you got to get blood work done. My advice to anyone who does blood work with my insurance company, I had to go to a different lab to get the blood work done. So it kind of had turned into a little bit of a problem. So I would recommend asking to get your blood work done like a week before your jaw surgery, so you have it before you go in to register with the hospital, because it was kind of touch and go as far as whether or not I was going to have my surgery or not because of the blood work. So I would recommend doing that for sure. I do know exactly what they're going to be doing to my upper jaw. The surgeon will come in and bring in the surgical molds. Obviously, my bite is together on the articulator, and it shows you exactly kind of where he's going to be, what he's going to be doing to my maxilla. So basically, he explained it to me. They are going to be basically cutting my upper jaw all the way around, and then they're going to move it forward just a little bit, and then back way in the back of my maxilla is where I have my problem. They're going to be shaving down, not cutting out. They're going to be shaving down 3 millimeters in the back on one side and almost 3 millimeters in the back on the other. And then my lower jaw will be able to close the 7 millimeters that it closes, which is crazy that it's that big. So, that's what they will be doing. I believe I will be in surgery for 3 to 4 hours. There's a lot of things you have to do before surgery, and I won't get into that because they'll give you all of that when you go. I am supposed to be in my splint. If you haven't seen my videos before, I have an open bite. I hit, actually, like that again. It's really, really bad. I hit only on one tooth, and I'm supposed to wear my splint all the time now. Don't even take it out to talk to you. So I can take it out to eat, and that's it, because I really don't want my jaw joints to be inflamed at all, because they will be inflamed after surgery. But I'll leave it out to just make this short video for you guys. So they also go over with you. They give you like a little book of pureed meals that you can make, and you go back. You're in the hospital for one. I'm only in the hospital for one night because I'm only having one jaw done, and then I go home the next day, and then I got to go back to the oral surgeon the day after to check to make sure that there's not an infection and stuff. So the hooks that were put in, they were like getting a wire changed. Really, it wasn't that bad. And you probably can't even see them in the video, but I just had to have additional hooks put in, and they do rub on your gum a little bit, but I'm used to that if you have braces on before you're having surgery. So you do have to check I have to check in the hospital early, and then of course wait for them to be ready for me, and then once that's done, you're in the splint. It's not really a splint like this, like the one that I have. It's a flat one that really guides your jaws to show them where they're supposed to go. And I will be rubber band. I am not going to be wired shut. I will have lots of rubber bands going up and down all the way around. And that is it. And I will close. And of course, once I close, all the pressure and stuff will hopefully be released off of my neck because I don't close all the way. And then eventually I'll be able to chew some food. I do have to, well, I don't have to, but they do recommend for me to go to myofunctional therapy classes after I am healed, or whenever they say that I'm ready to go, because I need to relearn how to swallow. I need to relearn my tongue position, and I need to learn how to chew with this new jaw position. I'm assuming that's because of how long it's been where I've been using my jaw incorrectly. And that's just to make sure I practice and I use it right, because I don't want to use it wrong again and have problems with my jaw again because I'm not using it correctly. I'm sure I'll be able to talk better because I talk with a lisp now. And that's about it. I'm not too sure if I'm going to continue to videotape myself when I have the surgery, because you have to kind of look at yourself, and I don't know when I will be comfortable enough to do that. So I will make my next video when I feel comfortable enough, and hopefully things go well with the surgery. I don't think I have any other advice for you except for do your blood work like a week before you go in to have your pre-op done. And then plan to be at your pre-op appointment at the hospital for hours, because I only had to do an EKG and have my blood pressure checked and have blood work done, but I had to go to a different place. So make sure you have your blood work done before you go, if your insurance doesn't cover it at the hospital. And have a list of questions for your surgeon, of course. And definitely practice with some liquid food, because I'm on liquid diet anyway. But if you're not on liquid diet and you're actually able to eat now or chew at all now, I would start practicing with some of the recipes, start making some recipes and try to drink them through a straw, or I've even tried to syringe them in the back of my throat just to get me kind of used to the fact that that's what's going to be happening to me soon. So I'm doing that so that I know what I like and I know what I don't like. Stock up on Ensures and Carnation Instant Breakfasts, and get the book Dinner Through a Straw, and make some of those and just kind of test them out. That way you're prepared. I was told by other people that have had jaw surgery to ask for extra syringes at the hospital, so I'm going to go ahead and do that, because I guess they break or snap or something like that. So other than that, wish me luck, and I will see you at my next video with my open bite closed. All right, thanks so much, guys. Bye.